Greetings again, this is Dr. Bill Wyatt, and I thought we'd talk about a most simple Class 3 case. There's two or three other things wrong with the case, but it's a very easy, simple Class 3 case to do, where we just remove one lower central tooth, but the lady has a big tori in the mouth and some other problems that are cross bites and stuff that they'll fall in place, and we'd have to, if you remove the tori, that's a big problem, but we're not going to cover that in this particular video. Let's get started on it as quick as we can, and I'm going to have to show you. This is a finished case, and you're looking at the case after it's finished. You see you remove one central and put the other one right in the center, and you notice that center tooth of their midline is right down the center of the tooth. So we've already finished this case. In other words, we got a cross bite here and a tori, and we're going to recommend taking this tooth out, and then we'll close these teeth together and close that space up right in there. It's a very simple Class 3 case that's very simple to treat that part. Jumping the bite and the other things are a little different. All right, on the right side of the mouth here, we've got a Class 1 situation, which we want to keep. Got a little cross bite right here, and we'll jump it over to. And now let's look at the other side, and we're lined up Class 1, just a little super Class 1, with a couple of teeth that are going to have to come out and put over the top over that. But basically, it's a simple Class 3 case. And you look at the upper, you left straighten it out too, and down on the bottom, she's got some large tori. Now, if the patient really wants these out, you have to loosen the tissue here, and this will be like a knot on a log, and you'd have to grind this off, both of them, but you'd have to have an oral surgeon do that. However, when I was in school, they let me do that on my father. Now you take this tooth out, and then we're going to pull all that together. And so when we finish up, we'll have those teeth lined up. It went from that point back to this point with the teeth underneath there. And so here is the deal. It would been nice if we had a wisdom tooth back here, and we could take this out and slide that up there too. But the wisdom tooth is gone. If somebody had known how to do that when they did that tremendous root canal on that, they could have closed that gap up over there. All right, here we go. We took the tooth out and we moved those teeth. We jumped the cross bites and lined the teeth up. And here the case is after we finished. And there's the smile. You see the cross bites are gone. The tooth right in the dead. I'm sorry, it's over this way. And here the profile has not been changed hardly at all. You can hardly tell. Now you end up with the central that's left. In other words, we're going to scale that off. This is the central on the right side. It's moved over to this point. And then these teeth are all in underneath here. And this is a simple way to correct a simple Class 3 case. And we jump the bites and add both of those to cross bite. And I don't think anything was done with the tori. So that's what can be done. And here we'll show the case right with one another. And you put a retainer in there with a little bite plate where she bites into that, so it'll stay right in that spot, right at that case. Now I'm going to go and the bottom now is lined up correctly, going in here. And there's the tooth that we took out of there. What we did, we extracted this tooth, or somebody did, and we took the tooth and ground it down, and we put it in there, and we closed this space till we got it down about that wide. Then we could take it out and finish it, and the lady wouldn't be running around with that tooth, big gap down on the bottom teeth. So here we are, and this is the way we started the case. Excuse me. And this is the way it finished. And it certainly made her smile much better to finish it out like this. So this is a simple class 3 with 2 or 3 other problems that are not major problems orthodontically to do. So thank you for watching, and I hope this will answer some questions. If anybody has a question or something like this, then drop us a line on our program here, and we'll try to answer your questions on that as much as we can. And thank you now, and I'll sign off.